HIV/AIDS has affected the lives of almost 500,000 African Americans. In an effort to support HIV testing and care, the City of St. Louis Department of Health will be observing National Black HIV Awareness Day. Here to share more is Kerr Washington from the Department of Health and Katrina Kerr, who is the president of the St. Louis chapter of the National Coalition of 100 Black Women. Welcome, Katrina and Karen. So glad you're both here. So let's talk about HIV/AIDS. I mean, it's something it's a topic that's been in our country, in our culture, in our world for decades now. But honestly, a lot of people think it's kind of gone away. It's changed, so it's not gone away. Obviously, you wouldn't be here. So let's talk about that.
So the theme this year of National Black HIV/AIDS Awareness Day is stay focused, the fight is not over.
Okay,
so
stay focused, the fight is not over. So that's telling us something.
So that being said, African Americans are a high proportion of HIV diagnosis.
Okay.
And so we are stressing testing to know your status, testing to reduce the risk of spreading HIV to partners.
Yeah.
To
okay, so why is it affecting the African American community in greater numbers?
There's stigma and testing.
So lack of testing.
Lack of testing, and just people live in fear.
Okay.
So education, get informed, get tested, and to know that there are services that's available to link them to care.
Yeah, so people are afraid. I mean, you know, even if you're not even in a group that's likely to be exposed to HIV, there's still, like you said, a stigma. There's a fear of being tested. Oh my gosh, what are the results going to be? And I think that comes from the 1980s, 90s, where it was way more prevalent in our general society. And there was this stigma that it's a death sentence, right?
Exactly. So this is why we are bringing awareness to, on February the 7th, from 10 a.m. to 2 p.m. so that people can become aware of and get informed and get tested.
So can they get tested right there at the event?
They can get free HIV testing at the event at 1520 Market Street.
Okay, so we're going to talk more about that in a moment. Katrina, let's talk about you and why you're here. So the National Coalition of 100 Black Women, you're the president of the St. Louis chapter, is that right?
Yes.
All right, so tell us about the coalition and why you're here partnering with the Department of Health.
Okay. Our mission is to advocate on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. And so our partnership with the St. Louis City Department of Health is imperative because it's our job to get the awareness and educate our community on knowing your status and getting tested and not being afraid. So our partnership with the health department is very important, and we've been partners with them for a few years.
Okay, very good. So getting the message out to women, to girls who are sexually active and could be exposed, is that right?
Yes.
Okay, and it's not just a men's disease, it's everyone.
It's everyone.
It's everyone.
Yes.
Okay, so what is the recommended age for getting tested?
According to risk factors, 13 through 64 years of age.
So 13 to 64, and how often?
How often, according to your risk factors, some once a year, some some once a year, and if you've never been tested, get tested.
So, and I would say, to add to that, perhaps once a year if you're changing partners. Is that correct?
Correct. If you're having unprotected sex.
That's right. Okay. So we're going to take a quick break right now. We're going to come back to talk about some prevention opportunities that we have through the Department of Health and also what to do after you're tested, right? So stay with us for more STL Live. We'll learn more about National Black HIV Awareness Day after this break.